Hi, everybody. It's Dr. O'Connell, and welcome to this week's episode of Empowering Indigenous Health. There's been some new guidelines from the CDC about what those of us who have been fully vaccinated can do now that we have the vaccine that we couldn't do before. So let's talk about those guidelines. The first question you might have is, what does it mean to be fully vaccinated? You're considered fully vaccinated if you've received 2 doses of the Moderna or Pfizer vaccine or the 1 dose of the Johnson & Johnson vaccine at least 2 weeks ago. So if you've had your complete series of your vaccine for COVID-19 and it's been 2 weeks or more, congratulations, you're fully vaccinated. What can you do now that you couldn't do? First of all, you are now able to gather with other people who are also fully vaccinated without masks and social distancing. If you have friends or family members who have also been fully vaccinated, you can get together with them, which is great. We can start having social gatherings again. Additionally, you can also get together with people from one household that haven't been vaccinated as long as they're low risk for severe COVID-19. If you're a grandparent and you've been fully vaccinated and you really want to go see your children and grandchildren, you can safely go visit them as long as you visit only people that live together and everybody in the household is not at high risk for severe COVID-19. This is not the time to get everybody together, all your children and grandchildren. We're not there yet, but you can go visit a single household as long as everybody in the household is low risk, even if they're not vaccinated. The third big change is that if you have been fully vaccinated and you're exposed to someone with COVID-19, you do not have to quarantine as long as you don't get COVID-19 symptoms. Those are all the things we can do now that we're vaccinated, but there are some things that we all need to continue to do to keep each other safe, whether we're vaccinated or not. First of all, we all need to wear a mask and social distance anytime we're in public. We need to keep doing that to protect our communities and ourselves. Additionally, even though we can get together with people who haven't been vaccinated, we should not be gathering with people who haven't been vaccinated who are at risk for severe COVID-19. We need to keep wearing our masks and social distancing around those vulnerable people. Also, we need to avoid large gatherings with anyone still. We don't want to be around a lot of people. And finally, anybody who has COVID-19 symptoms should get tested for COVID-19 to make sure that they don't have the disease and can give it to others. Vaccines are offering us a new chance to get together again and gather, and it's very exciting. So we strongly recommend that when it's your turn, you get whichever vaccine is available to you. These guidelines apply to any of the vaccines. They're not specific. So when it's your turn, get your shot and get vaccinated for COVID-19. If you have questions about these new guidelines, check out these websites. Thank you for joining us for Empowering Indigenous Health, where we give you the facts you need to take control of your health and wellness.